Hey everyone, welcome back to the channel. Today we're diving into an incredibly important topic, antibiotics. These are life-saving medications that have completely changed the way we fight bacterial infections. So let's break down what antibiotics are, the different types out there, and how they work. By the end of this video, you'll have a clear understanding of how these medicines help us and why it's so important to use them responsibly. Let's get started. First up, we have penicillins, the original antibiotics. These were some of the first to be discovered, and they're still widely used today. Penicillins work by attacking the bacterial cell wall, which is like the bacteria's protective shell. Without this shell, the bacteria can't survive. Penicillins are especially good at treating infections caused by gram-positive bacteria, which are a type of bacteria with thick cell walls. Examples of penicillins include amoxicillin, ampicillin, and others like oxacillin that are resistant to certain bacterial defenses. You'll often see these prescribed for things like respiratory infections, skin infections, and UTIs. However, one thing to watch out for is allergies. Some people can have mild to severe allergic reactions to penicillins. Next, let's talk about macrolides, like azithromycin, clarithromycin, and erythromycin. These antibiotics work by stopping bacteria from making proteins they need to grow and multiply. Macrolides are a bit more versatile because they're effective against atypical bacteria, like mycoplasma and chlamydia, as well as some gram-positive bacteria. Doctors often prescribe macrolides for pneumonia, certain sexually transmitted infections, and soft tissue infections. They're also a great alternative for people who are allergic to penicillins. A standout feature of macrolides, especially azithromycin, is that you don't need to take them for as long, because they stay in your system longer. That said, they can sometimes cause stomach upset or heart rhythm issues, so be aware of those potential side effects. Moving on to cephalosporins, these are closely related to penicillins and work in a similar way by targeting the bacterial cell wall. What makes cephalosporins unique is that they're divided into generations. Each generation has a slightly different focus. For example, first-generation cephalosporins like cephalexin are great for gram-positive infections like skin infections, but as you move up to the later generations like ceftriaxone or cefepime, they're better at targeting gram-negative bacteria and even tougher infections like meningitis or sepsis. Some fifth-generation cephalosporins like ceftaroline can even tackle MRSA, a super-resistant type of bacteria. Cephalosporins are incredibly versatile, but they do share some allergy risks with penicillins, so always let your doctor know if you've had an allergic reaction before. Now let's talk about fluoroquinolones like ciprofloxacin, levofloxacin, and moxifloxacin. These antibiotics go straight for the bacteria's DNA, stopping them from reproducing. Fluoroquinolones are particularly powerful against gram-negative bacteria, including tough-to-treat ones like Pseudomonas aeruginosa. They're commonly used for UTIs, gastrointestinal infections, and respiratory infections. One big advantage of fluoroquinolones is that they're easy to take as a pill, which makes them super convenient. However, they do come with some serious warnings. Side effects can include tendon damage, nerve pain, or even heart rhythm problems. Because of these risks, doctors typically save fluoroquinolones for when other antibiotics aren't an option. Tetracyclines, like doxycycline and tetracycline, are another class of antibiotics you've probably heard of. These work by stopping bacteria from making proteins, similar to macrolides, but they're effective against an even wider range of bacteria. This includes gram-positive, gram-negative, and atypical bacteria like Rickettsia and Borrelia burgdorferi, the bacteria that causes Lyme disease. Tetracyclines are often prescribed for acne, respiratory infections, and tick-borne diseases. They're even used for malaria prevention, but here's the catch. Tetracyclines can bind to calcium, which can discolor teeth and affect bone development. That's why they're not recommended for kids under 8 or pregnant women. Another side effect to watch out for is sensitivity to sunlight, so don't forget your sunscreen if you're on these meds. Finally, we have sulfonamides like sulfamethoxazole, which is often combined with trimethoprim to form cotrimoxazole. This combo works by blocking the bacteria's ability to make folic acid, which is something they need to grow. Sulfonamides are effective against both gram-positive and gram-negative bacteria, as well as certain opportunistic pathogens like Pneumocystis jirovecii. They're often used for UTIs, certain respiratory infections, and infections in immunocompromised patients. While sulfonamides are incredibly useful, they can also cause side effects like allergic reactions, kidney stones, or, in rare cases, severe skin reactions like Stevens-Johnson syndrome, so it's always important to use them under medical supervision. So how do doctors choose the right antibiotic? It depends on several factors like the type of infection, the bacteria causing it, and whether you have any allergies or other health conditions. For example, penicillins and cephalosporins are great for many gram-positive infections, while fluoroquinolones or sulfonamides might be better for gram-negative bacteria. Tetracyclines and macrolides are excellent for infections caused by atypical bacteria. The key is to use antibiotics only when they're needed and to follow your doctor's instructions closely. Overusing or misusing antibiotics can lead to resistance, which makes infections harder to treat in the future. And that's a wrap on today's deep dive into antibiotics. From penicillins and cephalosporins to macrolides and fluoroquinolones, each class of antibiotics has its own unique role in fighting infections. These medications have saved millions of lives, but with great power comes great responsibility. Always use antibiotics wisely and under the guidance of a healthcare professional. If you found this video helpful, make sure to like, comment, and subscribe for more content like this. Thanks for watching, and I'll see you in the next video.